The first thing that you'll notice that it's very soft and very flexible and easy to the touch. There's nothing hard or pokey about this whatsoever. We have the soft bite block. It's soft, it's flexible, and it's a patented bite block. The great thing about the flexibility of this bite block is the patient can actually rest on this thing and flex their jaw. So you never have any static fatigue when the patient is just locked into position and they can't move their mouth at all. The second part is the tongue protector, which is this oval-shaped part right here. This keeps the tongue protected and out of the way of the handpiece or the dental drill. Worst thing that you want to do is cut a tongue. I know we've all done that before, but with this tongue protector, it will literally be impossible for you to cut a patient's tongue. The next part of this is what we call the isthmus. It's the narrow part, and this isthmus becomes the throat protector, which when it goes back against the back portion of the throat, seals off the patient's throat, thus preventing any inadvertent droppage of material going down the back of the throat. The airway is still wide open so you can breathe very nicely. It's never compromised whatsoever. Moving on to the distal part of this, we have what we call the cheek protector or the whale's tail. I call it a whale's tail because it looks like a whale's tail. Now, the Icelite mouthpiece has vacuum channels built into this. Going right across here between these little flaps, it vacuums from the superior aspect as well as from the inferior aspect. And besides that, it also vacuums from the back end of the bite block. So we have peripheral aspiration of fluid. This includes going around onto the cheek side and into the buccal vestibule as well. The throat part of the Icelite mouthpiece is where the head of the Icelite system attaches to and connects to the light source and to your vacuum system. So those are the parts of this mouthpiece. They all work together to make your patient's visit much more comfortable and to make your time in the chair, the dentist time or the hygienist time in the chair, much more productive and much easier on you too.